The medical features of the patient, their travel destinations and dates, their activities, and the epidemiologic background of the area where the illness is thought to have happened are frequently used to make an initial determination of yellow fever. The most common method of laboratory diagnosis for yellow fever is blood testing to look for virus-specific IgM and reducing antibodies. Blood tests collected early in the disease might occasionally include the virus. In fatal scenarios, viral culture of biopsy or autopsy tissues, histopathology with immunohistochemistry, and nucleic acid amplification can also be positive. These specialized tests can only be performed by a small number of state laboratories or other specialized labs, including those at the CDC. Yellow fever is not specifically treatable. This is because the virus is kept alive in nature via horizontal transmission, via blood feeding mosquitoes, transviral transfer incapable vectors, and transmission between non-human primates. The NHP population is one of the reservoirs, hence the YF virus cannot be eliminated. Dehydration and fever are conditions that can be treated at a hospital. You could require more intensive treatment in the hospital if your symptoms are severe. The primary goal of medical therapy for yellow fever is to reduce symptoms like fever, muscular aches, and dehydration, because there's no cure for the viral illness itself. If you think you may develop yellow fever, stay away from aspirin and other non-steroidal anti-inflammatory medications due to the possibility of internal bleeding.
How to prevent mosquito bites. Take steps to control mosquitoes indoors and outdoors. Use screens on windows and doors. Repair holes in screens to keep mosquitoes outdoors. Prevent mosquito bites when traveling overseas. Sleep under a mosquito net. Sleep under a mosquito net if you are outside or when screened rooms are not available. Mosquitoes can live indoors and bite during the day and night. Use mosquito nets correctly. Mosquito nets can be hung above a bed or crib to protect against mosquito bites. Adults and children should sleep under a mosquito net if air-conditioned and screened rooms are not available.
The symptoms of yellow fever include fever, chills, headache, backache, and muscle aches. Symptoms of yellow fever will prevent 3 to 6 days after they infected. Who infected by yellow fever have 12% probability to change symptoms, go on to develop a serious illness, like jaundice, bleeding, shock, organ failure, and sometimes will be die. So that means when people had those symptoms, I recommend to go to the hospital as soon as possible, as maybe yellow fever. To summarize, the causative agent of yellow fever is mosquito, because the yellow fever virus just can spend the blood by blood, and that virus must live with the human cells.
Predisposing factors of yellow fever. The risk of yellow fever infection to a traveler depends on a variety of factors, including immunization status, location of travel, season, duration of exposure, occupational and recreational activities while traveling, and local rate of virus transmission at the time of travel.